Afternoon, everyone. I think we are now live. A warm welcome to today's panel discussion, which looks at care after COVID, building a better adult social care system. My name is Alexandra Joseph. I'm the non-exec director and a member of the board of Bright Blue. And if you haven't come across us before, Bright Blue is an independent think tank and pressure group for liberal conservatism. Our research focuses on domestic, social, educational, environmental and economic policy. I should also mention in my day job, I'm a senior development manager at Transport for London, charged with the delivery of 1,600 new homes in central London. In hosting this event, we are very pleased to be partnering with the Associated Retirement Community Operators, ARCO, which is the main body representing the retirement community sector in the UK. The format is that I'll invite our speakers, who I'll introduce shortly, to share a few opening remarks, and then we'll go to the virtual floor, so to speak, for a question and answer session. We are live tweeting the event, so if you're on Twitter, please do use #CareAfterCovid and the handles @WeAreBrightBlue and @ArcoTweets. And please do submit your questions via Slido. The number or the passcode is #300, and we'll take as many as we can. COVID-19 has had a devastating impact on adult social care. Deaths in care homes have run to the hundreds of thousands and has served to put the spotlight on the sector. But in doing so, it's also highlighted issues that existed well before the pandemic, such as the issue of low pay and high turnover amongst care workers. And those who enter the care system in need of support are frequently confronted with large costs and limited options, particularly with respect to housing choices. Even prior to needing care, older people looking to right-size their homes whilst they are fit and healthy have a shortage of suitable options. The government has committed to finding a lasting cross-party consensus around the financing of adult social care, and yesterday's spending review announced an extra £1 billion next year for social care, 300 million of which comes via a children and adult social care grant, and the remainder via a top-up to council tax that must be directed at adults' services. But is this enough, given that COVID-19 should really be acting as a watershed moment for the sector? What more needs to be done to ensure the UK builds a more resilient and responsive adult social care system? So this afternoon, we'll be asking our panellists to explore some key questions, which we've put to them, including how will attitudes towards and choices in adult social care change further after COVID-19? What role has regulation and policy played in limiting consumer choice in adult social care? Are there policies that could drive up the quality and safety of care received by older people? What is needed to attract more institutional investment and consumer spending in social care? And can housing with care play a greater role in elderly social care provision in the UK? And if so, how? So we're delighted to be joined by 4 expert speakers, including the Right Honourable Jeremy Hunt MP, who is Chair of the Health and Social Care Select Committee, Phil Bayliss, CEO of Later Living at Legal and General Capital, Michael Voges, Executive Director at the Associated Retirement Community Operators, and Samir Gray, former Chief Knowledge Officer of the NHS. So thank you all for joining us. We have 5 minutes for each speaker, and I'll invite Jeremy Hunt MP to open up the discussion. Jeremy.
Thank you very much indeed, Alexandra, and thank you for holding this session. It's a really, really important topic, and as you rightly say, I think the whole country has realised our dependence on the social care sector in this pandemic year. I think those of us who have been involved in healthcare policy have always known that, but this is a year when I think we've seen the extraordinary hard work, selflessness, dedication, commitment of frontline staff, both in care homes and who go around visiting older people on their own. And I hope this becomes, therefore, a big moment of change. And really at the heart of it, it boils down to what sort of society we want to be. At the moment, older, vulnerable people on limited incomes are visited once or twice a day by a carer who has 15 or 30 minutes to give them everything they need, and compassion is counted by the minute. And very often you have to make a choice. Do I want to give someone a hot meal or help them wash? But the idea that you might have time for a cup of tea and a friendly chat is out of the window. We have large numbers of people who are living on their own, who are extremely lonely. And that can't just be the responsibility of the state to put that right. But we can perhaps do some enabling things to address that problem. Our care providers are basically going bust at the moment. And because of the squeeze on local authority funding, increasing numbers are simply saying we're not going to provide any local authority places, and we're just going to provide for self-payers. And that introduces a kind of apartheid into the system where wealthier payers end up having luxury hotel-like accommodation, with everyone else left to fight over what's left. And as Conservatives, we have always said that we're the party that, when push comes to shove, will address the big challenges facing society. And there is no bigger challenge than an aging population, where our life expectancy is going up on average by 1 year for every 8 years that we live. And it's a wonderful thing until you start looking at some of the conditions that some older people are living in, which I don't think are worthy of the essential British kindness and decency that most people would say are our values. So there are two choices we have, because there are two ways of solving this problem if you look around the world. One of them is the Mediterranean route, which is countries like Italy and Spain, where they don't really have a social care problem because older people live with their families. And that is very attractive, and indeed for the older people themselves is a wonderful solution because they get to live with their grandchildren. But the price they pay, and we need to be very honest about this, is much lower female participation in the workforce. And so I think in the end, that is not something that we would find acceptable in this country. And we are left with going for the Japanese or German solution, which is a properly funded social care system. And this is not going to be cheap. For demographic reasons alone, if you just look at the increase in older people in the rest of this parliament and the increases planned in the national living wage, one of which was announced yesterday, and quite right too, that's an extra 4 billion a year. This is a budget that's only 18 billion pounds a year to start off with. If you then wanted to do the Dilnot reforms, so that people who had really catastrophic care costs because they ended up with dementia or motor neuron disease, and you said that people would only have to pay the first 40,000 odd of those costs, that's another 3 billion a year. So you're talking about probably a 7 billion a year increase. And we know that it's not possible to find that from the back of a sofa somewhere in the Treasury. These are very large sums of money. And I think the fairest way to approach these funding needs is to say, well, it's going to be a combination of the taxpayer and personal responsibility. The taxpayer, in both Germany and Japan, they have a small hike in national insurance for people over the age of 40, sort of 0.5% or something like that. And interestingly, in both those countries, there's been very little pushback to that from the general public. Just like in this country, there's been no pushback to the social care precept that George Osborne introduced, because everyone understands we have to deal with this challenge. But the personal responsibility would come because under the Dilnot reforms, everyone has to find the first 40,000, 50,000 pounds of savings towards their care costs. And that would be an incentive for everyone to save. At the moment, we destroy that incentive because if you don't have any savings, the state picks up the whole tab. So I think that is the way that we can solve this. That would be the solution that I would advocate. And I think that anything less would be a betrayal of our British values.
Thank you very much, Jeremy. Really interesting opening points, and I think we can come back to this balance around personal responsibility and government responsibility later in the conversation. I'll make one additional correction on myself, and that I meant to say hundreds of tens of thousands of deaths, not hundreds of thousands of deaths in my opening. If I could now invite Phil to say a few comments.
Thanks, Alexandra, and terrific opening remarks, Jeremy. It's interesting over the last 24 hours, the fascination of the many in public policy and in the city around the spending review and what Rishi will do and won't do. Not us, actually. We have very few asks of government. For background for anyone that doesn't know Legal and General, one of the world's biggest investment managers, we manage over £1 trillion of pensioners' money. We're the biggest investor in the UK. We've invested over £20 billion in real assets across towns and cities in the UK in the last 10 years. My responsibilities I'm the chairman of 2 of our retirement community businesses, and the frustration that we have is we'd invest a lot more, and we have patient long-term capital making the right decisions for the long term and using society's capital for society's future. So some of the budgetary constraints that are well known that Jeremy was highlighting, I look at slightly differently and say the world is awash with money right now. There's over £15 trillion of negative yielding assets. I give you £100. In 5 years' time, you give me £95 back. There's £15 trillion globally invested in assets like that. So surely isn't it government and private sector's responsibility in the UK to become what I describe as world-class at designing a framework for investment? And this is thinking about all of the major challenges we face. And Jeremy said aging society is clearly one of the grand challenges our generation is going to face. How we deal with that, good or bad, is going to define part of the success of mankind going forward, as is the environmental challenge that we face. And creating a framework for how we invest, particularly the right sort of money, the long-dated patient capital, pensioners' money, investing people's savings now for everyone's future. And that, in my mind, is when I hear about care reform, which has obviously been around for many years and has been broken for many years. I think reform has to be about how we find a stable funding platform that is available for everyone and encouraging more diversity in terms of the investment in and less heavier reliance on the government to fund and find the solution. On the bright side, I'm an optimist. We're a prolific investor across the UK, and where those conditions are right, we've shown time and time again we'll continue to invest. We've, in the last few years, already committed a few £1 billion into retirement communities across the UK, where we've quietly become one of the biggest house builders in the UK with 6 companies, over 2,000 employees, delivering thousands of homes. And I expect we'll do something similar in accommodation for the elderly. The final point I'd probably make is, I think when I think about the capital side, and I'm representing probably in an investor's mindset on this, I can't help but think about, isn't prevention where we should be? And I'm delighted to be joined by Sir Muir Gray. Every time I see him, I think I need to upgrade my shirts, but also he gives me an extra bit of vocab for my speeches going forward. And one you've given me and I've stolen many times, Muir, is health span. And in my mind, I think that's a wonderful way to capture where we should be going as a society. And Jeremy said, what sort of society do we want to be, and how do we want to position ourselves? And I, for one, as an individual, before an investor, I think about my own family, and I think, get the steps right now, live a healthy existence, live in the right built form appropriate for you, and in a community where you thrive, rather than suffer and then require the care. And that's where our focus on investment will be, is how we can drive that early intervention and encourage the positive behaviour to drive prevention. Thank you.
Thanks very much for that, Phil. I mean, 3 points there around not needing to ask government for a huge amount of money, the diversity of investment, and this health span versus lifespan. Thank you for that. I'll just flag that again, that we've got Slido #300 is the number to access for entering questions, and I'll now pass over to Michael.
Thank you very much. And I was struck by both Jeremy's and Phil's comments. And I suppose the aspirations and British values question is, for me, one that's quite interesting. For me, one of the issues that I think sometimes goes wrong when we talk about social care reform is that there's a lot of talk about the how much, but we don't talk enough about the how, as in, how are we going to deliver care and preventative services to people in the UK? And I think if you look back to the last time when the social care sector really changed in the UK, that was in the 1980s, when the independent care home sector developed. And that's when you saw the shift away from long stay hospitals into care homes provided by private and not-for-profit companies. And then if you look at what's happened since the 1980s, well, two things have happened. One is that people age differently, and we live much longer. The average life expectancy was 75 in 1985. It is now roughly 83 for women. And the other thing is that actually the social care system, and aspirations have changed since the 1980s very considerably. I think where that values-based question comes in. But what hasn't really changed is the broad categories about how we think about the delivery of social care, because we think about domiciliary care and there's the care home. And that still is the two polarizing debates in which social care really works. And I want to show just one slide that shows that actually, if you think about it in that way, there is a crucial difference to actually what the care home sector did in the 1980s and what it did today. So I'm going to try and share that here. I think that should have come up on your screens now. I've picked 1987 because the expansion of the care home sector in the UK was actually driven by deregulatory changes in 1980 with the first Thatcher government. There was a Registered Homes Act, I believe, in 1984. So regulation was a crucial part to make that first shift from hospitals to care homes happen. In 1987, when the planning use class order came in, the continuum of care would roughly be covered like this: outside of home care. You had residential care homes for people who were still reasonably fit, and people running care homes at the time would say, a typical customer would be the retired, 70-year-old who would, the wife had died, couldn't boil an egg to save his life. He'd drive down to a converted residence in a suburb somewhere, Victorian residence, and say, look, can you look after me here? Bring in his car and his dog. It wasn't really about care provision back in those days. What they would also tell you is that if you needed an incontinence pad in those days, you wouldn't be in a residential care home, you'd be in a nursing home, because your needs were deemed to be medical and of a higher level of acuity. And we still had about 43,000 geriatric hospital beds in 1987. Now contrast that to today and where that has moved to, and what you see really is that geriatric hospital beds have been phased out in that form. And nursing homes and residential care, via effectively, I think, a funnel of regulation that has sucked them upwards, now provide for people with really high-level care needs, and the average length of stay is now under 2 years, 18 months in some cases. But what that has meant is that we haven't really built anything in any significant numbers to cover that bit for people who might have some care needs, or only support needs, and who might need some support, and support that can flex up and down again. For example, once you come out of hospital, so you can be released earlier. That is the housing with care model, the retirement community model that Phil is investing in. And I think that's a really important point to understand, that ultimately care homes don't do what they did 35 years ago. And actually the regulatory framework that enabled the care home market to grow has not been replicated for other forms of housing or care in the UK. And that's why I think, for me, the main point is we need to think about, well, how do we actually provide care, not just how much we pay for it, although that is a crucial point. And Jeremy, I've got to say, I grew up in Germany. My father's German. My mother has a house in Scotland. So I'm kind of quite well covered, because the Scots still pay for social care at the moment, I think. Whereas in Germany, they're kind of covered by the insurance, and they're very happy about it. So I know that they're settled. But we need to think seriously about ways of how can we bring the housing into the mix here, and then who funds it, as Phil said, is actually going to be individuals themselves to provide healthier, or to live healthier, happier, and more independent lives.
Thank you very much, Michael. Good to know that you're covered there, and thank you also for that slide. I mean, that really clarified the provision gap, and maybe we can come back for this question on how later in the debate. And I would now like to invite Samir to speak.
Well, I'm going to tell you about the revolution that's underway. And I speak as the director of the Optimal Aging Programme at Oxford. And we've discovered the elixir of life in Oxford. It's called knowledge, and it has to be consumed through lifelong learning. And we now know that what happens to us as we live longer is not due to the aging process until the late 90s. It's due to loss of fitness, disease accelerated by loss of fitness, often because other people do too much, and by negative thinking. So what we need to do now is to increase health span and compress the period of morbidity at the end of life. For example, we could reduce the incidence of dementia by 40%. And we need to help people now drop a decade so that the average 85-year-old in 10 years' time will be the same as the average 75-year-old now. So that's what we're doing in the Optimal Aging Programme. And I'd like to pay tribute to Jeremy and the Social Care Act of 2014, which Section 2 is preventing the need for social care. Now, we have to go back to 1948. And Jeremy, I think it'd be very good to get the history of social care written. I spoke to Charles Webster, the official historian of the NHS, and that bit's never been written. But it wasn't thought out. Younger disabled people, the deaf, dumb, blind, and crippled, as they were called, had to be given education to overcome their difficulties. The aged had to be given practical assistance. I want to do away with the word care. It is now doing more good than harm. And one of the benefits of COVID has been what we call the second pandemic. The impact of lockdown is showing very clearly what happens to us if we become more isolated and even less active. So I think there's a need for revolution. I would not build any more care homes. I don't think that's appropriate. I think we need a cultural revolution, and we need a system, not a social care system, but a system for living longer, better. And this is what I did when I set up all the screening programs a number of years ago. We let the system float beside the bureaucracies. You don't worry about the bureaucracies. You set up networks working to a system. And we've designed a system, and it's got 10 objectives. For example, to reduce the risk of dementia, to provide better housing, to reduce the risk of a bad death, to support carers. This is systems thinking. And we're developing networks, population-based networks, because I've had 27 reorganizations of the NHS, most of which have made no difference at all. So I'm against structural reorganization. There's a few things we need to tweak in the structure, but that's not the solution. Interestingly, the organizations that I'm finding the best to work with are Age UK and Sport England, the activity partnerships of Sport England. And Jeremy, we need to help shift a couple of $100 million from the drug budget for older people to an activity budget. That's physical, cognitive, and emotional activity. So that people, even if they're in their own homes, 500,000 of them are cycling, 500,000 of them are doing walking on a treadmill. They're doing it in teams. They're doing it in teams to raise money for a good cause, and they're competing with one another. I met with some people in McCarthy and Stone, and I said to these were people living there, and I said, well, the one thing that would motivate you people in Bourne End is beating those bastards at Wickham at raising money for the Bucks Wildlife Trust. And they roared with laughter. I said, yes, purpose, action. So I think what we're seeing now is the need for a paradigm shift, and it needs to move. And Jeremy, I'll need your leadership. COVID will pass. It's been very useful, COVID, to me, like Lehman Brothers was very useful in introducing value-based healthcare. But we are now seeing the need for a new paradigm. And I see housing at the center of that. I did my first study of housing in Oxford in 1973, and there was under-occupation of people who needed their house adapted. They would share their house with other people. Some wanted to move, and I fully support moves to communities. That's absolutely essential. I'm very interested, as L&G knows, in providing knowledge as well as money. And we'd like to start with L&G pension people. But we are, Jeremy, we've now worked out how to use the GP information systems to give people information, knowledge, support, stimulation. Okay, only 70% are online at the moment, but that'll change very quickly, and that's another priority. So down with care, the end of social care. What word shall we use? Maybe supporting, maybe enabling, but I quite like the word coaching. Coaching helps people close the gap between potential and performance. And with very strong scientific evidence, we can do that for people in their 60s, 70s, 80s, and 90s, no matter how many long-term conditions they may have.
Thank you very much for your reflections there, Mia. I think the call for paradigm shift really, and looking at I suppose the preventative approach of not needing care, and I think we could all occasionally wish that we could drop a decade.
You can.
I would like to now open up questions to the floor, and they're beginning to come in. I'll start with perhaps coming back on Michael's question of how. So my observation from what we've heard already is that we can see these demographic changes coming down the track. Michael's sort of looked at us, taken us through a slide that dates back to 1987, and Jeremy mentioned the Dilnot report in 2011. And Phil said we're not actually looking for a huge amount of money from the government to help solve this problem. So what is it really that we feel the needs to unlock this supply problem? And in terms of numbers, I know that JLL's written a report which says that there's a need for 10,000 additional care home beds per annum to 2030 if we're going to address these issues. So could I just get the panel's responses to that? I can't see everyone, so do just jump in if you would like to say something in response to that.
No more care home beds.
No more care home beds. Any advice on that?
I'll come in and just say I think what Muir said is absolutely fascinating, because what he's done is he's used the benefit of stepping back from a frontline role in policy making to actually look at the bigger picture in a way that often is difficult when you're in the midst of it all. And I think he's absolutely right, actually. I think Italy banned the putting of anyone in institutions. So we have had a successful policy of moving mental health patients into the community, but Italy went one step further. And we still have a lot of asylums. They're not called that, but they're places where we park people with learning disabilities, often hundreds of miles from their home, paid for by the local CCG, but unfortunately out of sight is out of mind. Yep. Run by some private provider. And, you know, it's actually quite shocking. These are people kept under lock and key. You know, it's something we should think about. And I do agree with you. I think people want to live in their own homes. They don't want to live in an institution. And that means a housing revolution and an education revolution and much bigger thinking. So that's my comment, really. I think you do need still to find some money for the short-term issues, because I think the problem is that, you know, if you've got an older person who is vulnerable on her own at home in her 90s with the early stages of dementia, you've got to do something quickly. Otherwise, she's just going to end up dialing 999 at 10 o'clock at night when something goes wrong. So there is an immediate need for financial support, but in the long run, I think we've got to do the kind of things Mia's talking about.
If I can maybe add to that, I think it's an interesting point about why it hasn't developed. And I think if you look at the funding question, so one thing I like to say is I think there's a lot of care homes that do really good work and providing, you know, good care to people who are usually at the end of their life. And I think a lot of care home workers, if they've been moving into care homes for weeks at a time, they've really worked incredibly hard throughout this pandemic. But I'd just like to say there is this bit of the kind of the new generation of the retirement community model where it's not just the build a box and that's it, but where there's optional care services on site, which is the things that Legal and General build. The positive news there is that 2/3 of that sector is actually for affordable rent or social rent. So that extra care housing is working very well, and we should be proud of it. But the other issue is that that model is defined not in a single piece of legislation in the UK. So care homes are defined in lots of different parts. If you want to build a care home, it says in the planning system what a care home is. This particular bit, every other country with a flourishing market for retirement villages or housing with care has something like a Retirement Villages Act or Continuing Care Retirement Communities Act in the States and Canada and New Zealand and Australia. We don't have any of that. And we had one of our biggest not-for-profit members, you know, they were trying to build, they had a great site, they thought we could build a housing with care scheme here, but because they couldn't get it through planning, what they did, they just built a care home instead, because it wasn't defined. And I think that is a crucial bit. I think it speaks to Phil's point that as long as it's a bit of that Wimbledon or Premier League argument, you provide the pitches and we'll provide the players, and just get that framework right. Regulation, consumer protection, define it in the planning system, and then I think the money would flow, and that would increase choice for older people.
Phil, did you want to respond on that at all?
Yeah, I sign up to what Mia was saying. Is you stop learning and growing and you start dying, and what excites me is let's be experts on learning, growing, and continuing to do that for the whole of life. And all of the research coming out says that is what leads to a wonderful health outcome and a holistic one, mentally and physically. The crunch point around, and that's what I get the buzz out of what I do, you know, and I think around this is why we're investing in here we invest our capital trying to address some of the grand challenges we face as a society. And the grand challenge of how we age well as a society touches on this point around what point do you want to start considering what aging does to one's mental and physical state, and how we maximize our health span. The topical question is, well, why haven't we done more is the interesting point. And the start of that bottleneck for building this stuff is our planning policy framework. National Planning Policy Framework, which is a dry read, but one I've done, has actually done, you know, that is a terrific bit of policy that's done a good job of pushing local responsibilities into local authorities and taking ownership of playing their part in delivering housing. What it does not do is anything in recognition of demography of the population. It does not take the responsibility to say we have X number of elderly in the local community, therefore we're going to deliver 20% of our housing for retirement communities. That is the bottleneck too. We need more supply, but more importantly, forget the investors, we need more supply for consumers so they got more choice. And that's what matters for a society, is having good quality choice. The only other thing I would add is we're not so blind to think that this is all that people are going to do in a retirement community. As you could tell by my accent, I'm Australian, and we've got a thriving retirement community sector in Australia. My dad lives in rural Australia, and he's got 4 retirement communities within about 5 miles of his house. And if he saves his money well, he'll go there. If he spends it all, he'll go down the one down the road. And he's got a choice, and he's got a selection of where he'd like to go. And that's a normal conversation with family and friends around planning for the future and where you'll live as you age.
I'm also trying to ban the word retirement. You'll be pleased to know it's renaissance, we're going to call it now.
Good.
People are moving on to do different things, and that needs to be encouraged. And
it does. And I see. So we need planning reform, Alexandra. We need something that addresses the supply side, so we have more choices.
Yeah.
And then the other bit that I see is, even if we do an exceptional job, only 5 to 10% of retirees are going to live in what Michael and I would describe as a retirement community. And I see it as their role to be the epicenter of this knowledge that Muir talks about. And it's not that everyone will live there, but a lot of the population should interact with it. And they can be the They can be the epicenter of the research. They can be some epicenter of the activities. They can really help foster the wider community. So this isn't some elitist gated development. This is core to the local community.
The key nodes in the network, Phil. Key nodes. We need a system and we need a network. And I think the communities you're developing are key nodes with energy. And then a lot of that energy is with people in their 60s, 70s, 80s, and 90s.
Yeah. I'd like to pick up a few points from here. The choice and the planning for the future. In particular, I mean, we have a generation rent that's coming to a point where perhaps they won't ever buy. Could the panel comment about how we manage that side of things? And at the same time, I'll pick up two questions that have come in from Slido. Retirement villages are nice, but what do we do about people who can't afford them? And Nick Francis has written, home ownership is increasingly out of reach. How would private investment support elders purchasing their own home, or is the expectation that rent would continue? So again, would someone like to come back on that in terms of the sort of future viability point?
I'm happy to, from an investor's sense. I would go back to what Michael said. So at the moment, and Jeremy, this is something that we've been trying to, Michael and I have been trying to reach out to government and haven't got very far. But at the moment, what is our business model? We provide quasi-residential service, mostly well-being and a bit of care to a customer. And somehow, because of the legislation environment, we use a feudal system where we sell 100, 200-year leases to an 80-year-old who's going to live there for 10 years. What's that about? And so, part of my answer to Nick asking the question of how we make this available to everyone, it has to be around what is the contract? What is our contract with our customer? And if I think of Australia and New Zealand and others, they make it a more mass market product by being much more fluid around how much you pay up front, what do you pay on the go, and what do you pay in the end, rather than rent or buy, because I still think that's actually quite outdated. And I think we should be thinking much more fluid around the lifestyle you'd like to live and how you go about living that. And we should have a financial solution. I use an easier way to explain is I use the example of car showroom forecourts. UK residential market is still stuck in the age where you only can pay cash for a car. And we need to move on to the days where you've got flexibility of payment options that suit your requirements. And that would be my response to making this more available to more people.
Jeremy, did you want to come back on any of the points raised there?
Well, I totally agree with everything that Phil said. I think it's absolutely right. I think look, retirement villages are a fantastic way forward. It's easier in some ways in countries where you have a lot more land than we have, but there's absolutely no reason. We do have a few here, and I think they're great places, and they've got a tremendous sense of community. And I think, if the question, we shouldn't not do these things because we're worried some people can't afford them. We should make it as easy as possible for there to be innovation in the provision of care for older people, and then ask the question, how do we put this within the reach of as many people as possible? I think you're absolutely right, Phil. We should have much more flexibility, but also much more clarity about what the deal is, where the state is going to come in and help out, and what is your personal responsibility. And that's why I am actually fundamentally a fan of the Dill Knot reforms, because they basically tell everyone, look, you're going to have to save the first 50 grand, you're going to need that. So you need to save that up. But then after that, the state will take care of the costs. And I think that is an encouragement to people to do the right thing.
If I could add something, Alexandra, because I think there's two things. One is, I think I mentioned that the majority of the housing with care sector in the UK is actually provided for those with more moderate means. So if you live in pretty much any local authority in the UK and your care needs and your housing needs are such that the local authority deems you to need to move to an extra care scheme, that placement will probably be available to you. The problem really is that for most people who own their own home, which is about 73% of the older people in the UK, I understand, the local authority will not take responsibility for you. They will expect you to use your own assets for parts of this, but you can't afford to move to that kind of higher end luxury retirement villages, which are great, by the way. But the big thing is in that middle market that we need to address, because there's very little optionality there. And I think that's really where regulation is almost the most important. And one thing that a lot of people, I think, misunderstand is that there's a difference between affordability and liquidity. Because if you look at an older person who is living in a house that's worth £1 million, but may not have a huge pension, then can that person afford to look at other options? Of course they can. Can they afford to effectively, tie up their entire assets in the bricks and mortar they're living in and still have those options? Maybe not. So I think if you look at the wider issue, then actually kind of the funding reforms are much more varied than just in terms of what are your assets and what are you living in. And that personal responsibility can come into it if you kind of turn things on its head a bit. But those with more moderate means in the UK are actually fairly well catered for right now. And we have members that do both the not-for-profit and the private payer side. We want that middle market to grow specifically, and we need to shout more about the great solution that extra care housing in the UK provides.
And perhaps that links to a question around the right sizing aspect of things. And do you think there's a cultural aspect to our approach to later living, in the sense that we need to encourage people to engage with possible later living solutions at a time when they're not actually in need of them, i.e. it is a forward-thinking approach? And perhaps that plays to some of the points that Samir's made around sort of living longer better. It's a preventative approach in time rather than a reactive response when actually things have got to be a little difficult. Michael or Samir, would you have any comments on that?
Yeah, this is part of the issue of a rethink, that we're now moving beyond three-phase life. And there's a very good book called The 100-Year Life by Linda Grattan and Andrew Scott. So I've been dealing with this, and I need your help here, Jeremy, with the pension industry. So the NHS Pension Board, 69,000 people retire every year, but they're going to live till they're 90. They need to expect that. The expectation of life at 60 is 30, and at 65 is 25. But what's in their mind? Well, some sort of vague notion about aging. And also, I'm afraid, still in the mind of the medical profession is some vague idea. So we need to think about a learning program that starts when people are going through this phase, the Renaissance phase, the first Renaissance phase. And this is what we're doing with GP information systems. But, and I've discussed this with L&G, who are doing very good work in Edinburgh with supporting research and development there. But we need to see this as a learning program. So as well as people getting money in their bank account every month, they need knowledge in their knowledge account every month to increase their reserve and resilience. People have no intellectual model at all about what is happening to them.
On the cultural point, Alexandra, I think the Phil probably knows more whether Australians are a bit more kind of chatty, or I think, Muir, we've had a chat in the past that, Scottish people are maybe more predisposed to move to retirement communities, but who knows? But I think there's different bits. I think in the past, the problem with housing for older people in the UK has been very, it's not been aspirational. It's been something where, if you look at a lot of sheltered housing, a large proportion of that stock was actually built as bed sits. And I think, if you talk to someone today, would you like to move to a bed sit? The answer is going to be no. And I think aspirations have changed. And I think what has also changed is that the next generation of retirement communities that we're seeing now you walk in and you see all the life that's going on, all the things that are going on. You're like, I actually want to live here. And there's a pull factor that, Muir, we visited one together, and I think, Muir, I don't think you're ever going to move to one of these. Like, don't worry, we're not going to try to set you up. But you can see that it's the kind of thing where you want to live, and we have to make them aspirational. The second thing, though, that's changed, and this is a really significant thing about how cultural attitudes change. I talk to a lot of customers, and what they say is the reason why I came here is that I provided care for my mother or my mother-in-law, and actually that the relationship that they had with their parents was strained. And often they're embarrassed and ashamed to actually admit that the impact and maybe the kind of the parental love they felt was impacted by very difficult decisions later in life. And what they say is, I don't want to do the same for my children. And that's why we have taken the step to go to an environment where we can look after ourselves better, support each other better, without having to call on my son or daughter who probably juggling childcare, both working and whatnot. And that's an interesting one where increasingly people are taking that mindset shift. So if you're talking about cultural changes, don't just look at the home ownership change, think about how they that thing and piety and how that might be changing over time.
Actually, I'll follow up with another. Oh, sorry, Jeremy, did you want to comment?
I just really wanted to once again follow up what Muir was saying, because I think we've had this rather mad cultural assumption for very many years that education is something you stop when you leave school or university, then you work, and then you retire. And all the studies I've seen of how to maintain your mental health and stop yourself falling into mental illness say that one of the key things is to carry on learning throughout your life. And I've certainly always found that true in my own case. And I think that it would be much healthier if you said that, when you leave school or university, yes, you're going to go down from full-time education to 1 or 2 days a week education, and then you go into the world of work, and then when you go into the last third of your life, you might then increase the education time. But I completely agree with that. I think it's a very important insight, and I think it's very underestimated by the approach we take to the world of work, where training is all too often seen as something nice to do if you can, but it's often to do with very specific skills needed for a job, and not life skills and broadening of horizons, which are equally important.
Thank you, Jeremy. Did anyone else want to comment on that, or we can roll to the next few questions?
I just as the token Aussie, I thought I'd comment on the cultural piece, which is I'm always cautious that given my accent, people get the sense that I'm going to roll out the Australian version of retirement communities across the UK, and that is certainly not the case. And we're very sensitive to this is quite a personal choice, and we have to be appropriate to the people moving into any given development that we build and operate. And then the however is, I do not buy that there's a cultural piece that this does not work in the UK. I just don't buy it. And I often use examples like they're remote, but I think people get it, is I use examples like diamond rings. De Beers were going bust in the 20s, and they came up with a marketing campaign saying diamonds are forever. And then 20 years later, 99% of women have an engagement ring that has a diamond on it. We didn't have coffee shops in the UK 25 years ago, and now there's one every 200 yards. The moment people get a concept, and this is far, far more important than a cup of coffee or a rock on your finger. The moment people get a concept, this will take off. And to Michael's point earlier, what we need to be experts on, and what I take real responsibility from our investments, is spreading the word, showing the difference we make. Because the moment we do that, that's the moment I have the answer around the culture, because any human being will turn up and say, I want to be a part of this. This is terrific.
Thanks very much for that, Phil. I'm just going to loop back to something that Michael was saying about the sort of strain of care and relationships. And there's a question that's come in that's anonymous here, which is, today is Carers' Rights Day. If you were able to make one change to better support the unpaid carers that save us 100 billion plus a year, what would it be? Jeremy, I don't know if you wanted to come back on that. And whilst you're thinking of the answer, I'll also ask another one to Phil, which is, in order to have flexibility on purchase options for later living with care, will leases or the sector need to be FSA regulated? So two very different questions there. Jeremy, do you want to come back on that first one?
Well, I think all too often unpaid carers have to fill in the gaps, and it's usually women who end up performing those roles. And the one thing we could really give them is a 10-year plan for the social care sector, just like we have a 10-year plan for the NHS, which looks at all the workforce requirements we're going to need, looks at the number of people going to need working in care homes, in home care, and make sure that we've got plans in place to recruit them, so that we don't have the looming crisis that we're currently having in the social care sector.
Yeah. Okay. Thank you very much. And Phil, did you? Sorry, if someone else wants to come in as well.
That's a terrific question around if we start offering up. I think I interpreted the question as, we start offering up changes in the way you pay for your home and the cost of occupying your home. Does that become a financially regulated product?
Yeah.
Regardless of who the regulator is, I think the point here that we've been pushing for some time is, we welcome that. We welcome consumer protection. And the big bang internationally in delivering better housing for older people has been primary legislation like a Retirement Community Act or something similar, that is consumer-led, consumer-focused protection. And part of that being, I find it very unusual being part of an insurance company where, and rightly so, when we sell a financial product, there is significant regulation and commitment by us to our customers around every single thing we tell them. And yet, as a house builder, you can sell a £500,000 home, and nearly anything could be on that glossy brochure. And obviously, through Legal and General, we commit to everything we say. Through the entire economy, the economy could do with some more oversight to ensure that there is more oversight to deliver what people say they'll deliver to a potentially frail customer base. So we would welcome more consumer-led protection through legislation, and actually that would bring part of this framework of more institutional investment to this sector.
Thank you for your response on that one, Jeremy. Sorry, no, I'll go to the next question. This is I would interpret this next question as more of a design one, or perhaps a human reaction front, which is, Jürgen has asked, why do care homes have to be so depressing? Can't we think of a better way to spend our last years? And in connection with that sort of, I interpret it slightly as a design piece, there was another question around the location of accommodation. So Tim has asked, how important is it that care accommodation is provided as an integrated part of our towns and cities rather than isolated developments forced to the edges? So two questions there around, I think, the design piece, either the unit or the scheme. Anyone want to comment on that?
Could I comment on the culture?
Absolutely.
And as I was saying, the history of Part 3 of the National Assistance Act has not been written, and we need to try and find out where it is. The woman who was writing it died, sadly, a number of years ago. But I think they were modelled on the sort of seaside hotels in Eastbourne, where the maiden aunt was dispatched, or the widow was dispatched. And so that's 3 meals a day and afternoon tea. And I've been running a bit of a campaign with a care home down the road, which is very, very good, but to stop them providing afternoon tea, because they don't let the people have a kettle to make tea for one another in case people get scalded. So, I mean, these are the sort of problems that we face with the current culture and the word care, and the homes are caught in this vicious cycle. So the design is one thing, but we also need to think about the culture. Interestingly, I gave a talk in Oxford on Zoom, of course, to my local library, and it was beamed into this care home. And 16 out of the 24 residents watched it. And they said things like, well, we thought there'd be a gymnasium when we came here. But there's nothing provided, and they're now locked in. So I don't think we should build any more care homes, and we need a bit of a revolution. But as Jeremy said earlier, the pressure people are under is with minutes. But we have to have the confidence that no matter how disabled you appear to be, if you start working your quadriceps, we can get you back to walking to the toilet on your own. And that's the key issue for both living in your own home or being looked after by other people. So we need a revolution. The revolution should not include any expansion in the care home sector. And it does require a significant change in the culture. For example, let's go from 3 meals a day to 2 meals a day, and let people help one another with a third, and give them a little bit reduction in their fees to make the pill easier to swallow.
Thank you, Muir. Any other comments in response to either Muir's comments or those questions in general?
I'd
Michael?
just like to say, in terms of the, I mean, care homes do fulfill an important role for those that need high levels of assistance, but I agree that it has to be enabling and not disabling. It is very difficult for politicians and regulators to get that right, because if you overregulate, which we may have done, then you get to the situation where you might be mollycoddling. But if you don't regulate enough, then there are certain newspapers that will basically say, you know, Secretary of State, what are you doing? And the regulator has failed. So there is a bit of a witch hunt going on in terms of, so someone once told me when I started in this sector, which is, as soon as you start working for vulnerable people, you make yourself vulnerable. And I think that's an issue whereby sometimes there's regulatory overreach, which leads to these kind of issues that we've seen. So I think it's a slightly tricky one. And then the other issue is, I think the way we look at, in terms of a cultural shift, I always describe it as, in the UK, we seem to pivot between aspiration and the apocalypse when we talk about older people. So we either describe them as this incredibly rich generation that wear, like, you know, kind of gin and teas in their hands going on cruises. That's the one narrative we have about aging. And the other narrative about aging is, it's the great tsunami. It's going to cost us all £1 billion, and you go to a care home that stinks of you know, urine or something like that. And in reality, aging is somewhere in between. The reality of aging is somewhere between those things, and we kind of, care homes cater to one, and I think we need to kind of shift them a bit more into the enabling and a bit more towards the aspirational point of that. And if you want a great example of it, there was a BBC clip about a year ago of an 84-year-old lingerie model. And she kind of said it was great to be sexy and to be kind of show that could be part of your older life. And then someone asked, the interviewer asked, so do you like getting older? And what she said was, hell no. No one likes getting older. But, you know, something like, but I'm sure as hell going to make the most of it. And I think that's the attitude that we need to get to. And then I think care homes could shift. And I think that's the same across the whole chain of how we provide or offer care to older people.
Excellent. We've got a couple more questions here. This next one I might again direct more to Jeremy. Jordan has asked, in elderly care, the line between health and social care is blurred. How should systems accommodate people with complex linked health and social needs? And I might add an additional layer to that and say, we haven't mentioned technology yet. Does the panel have a view on how technology could be brought into our homes to support people with their care needs? Jeremy, would you like to comment on that one first?
Yes, I mean, I don't want to have another big structural reorganisation of the health and social care sector. We've clearly got to integrate the care packages that older people receive so that they're getting joined up care where everyone knows what other parts of the system are doing. But I think we should do it from a patient's point of view, and we should basically say that all older patients in the social care system should have a single care plan agreed by the NHS and social care system on a single electronic health and care record that everyone who needs to is able to access. And that's where the joining up should happen at the patient-facing side. I think people are perfectly capable of coping with the fact that one element of their care is going to be delivered by one organisation and another element of it by someone else. And actually, they're perfectly capable of coping with the fact that some elements of their care are free and others they have to chip in for. So that we wondered whether that might be a big problem when we started doing this 5 years ago, and it hasn't been an issue at all. It's been the dog that hasn't barked, actually. But I just think if you go for a structural reorganisation, what happens is that the administrators spend hours and hours fighting over turf, forming new committees, making themselves redundant for one job and applying for the next. And nothing actually improves for the older person that you're wanting to give better care for. So that's why I guard against that.
Yeah. Okay, thank you.
I could just say what we're doing. It's interesting with the NHS understandably preoccupied and local government also under pressure. We've got now 20 populations led by the active partnerships of Sport England. This is the level of Lancashire or Yorkshire, quite big populations, I'm glad to say, Leicestershire, Merton and Wandsworth. And we're developing networks, Jeremy, so getting everyone around the table and say Age UK and the sports partnership, the active partnerships are really good because the culture is good there. And the NHS is obviously involved. So you have an individual, and the digital issue is very important. So we're now able to deliver exercise programs. Yesterday at the UK Active Summit, there was a great announcement that 500,000 hours of trainer time are being offered by the gym industry, even though it's under terrible pressure. And we now have a means by which the GP, if the GP type 2 diabetes, automatically we can reach the individual and say, well, tough, you've got it. Here's the program. And here's some local offers available for you. And here's some interviews from Diabetes UK. So with NHS Digital, we're developing this knowledge service. Now, as I said, there's still a third of people not online, but with non-typing computers, and I hate typing and I'm hopeless at it. So that's going to go. Typing is going to go. We're I think very good moves are being made, but you guys need to provide the accommodation. So I remain convinced of the importance of housing, not care homes.
Just leading on the question of housing, we mentioned right sizing earlier. Do you think that there is, I mean, I've read that a lot of NHS accidents or accidents that cause people to come into the NHS system are caused by inappropriate housing for the over 55s. Would a stamp duty for last time buyers have any effect in perhaps unlocking those right sizers who at the moment don't feel incentivized to move at the moment? Any comments on that?
Now, the most important cause of fall is weak quadriceps and coordination. So I say, if I'm speaking to people my age, I'm 76 with a number of health problems, I'm fairly typical, that no, we want you to do daily exercise. Daily dozen, 40 minutes if you're 80 and 50 minutes if you're 90, plus 30 minutes walking. If you're not doing it, then we will know you're not doing it, and I'll stop your pension. And the room all laughed. I say, no, this is for the NHS. You know, we've got to be responsible and get a grip. We can prevent falls significantly. So that the environment is important in falls prevention, but most of it is due to loss of skill, strength, and suppleness.
Yeah. Any other comments on that stamp duty policy point? Would that have any merit in this situation?
You know, we're obviously experiencing it right now because there's stamp duty relief for everyone.
Yeah.
Under £500,000, and we're selling across the country, and we're seeing the demand response. So it obviously works. If I look at snippets globally, and what I part of what I love about this is it's not like we're innovating in a vacuum box and no one's ever done this. There's thriving global comparisons that we can use, and there's lots of piecemeal bits of public policy that have worked and haven't worked, but certainly a nudge to reflect the public purse benefit from downsizing. And we do suffer a housing crisis in the UK, but we also suffer a housing productivity crisis. And what I mean by that is people living in the homes that suit their needs. And when stamp duty continually got increased, what you saw is everyone locking down into where the home they happened to live in when the music stopped, and stamp duty went up and up and up. And now you've got a whole host of people living in accommodation that's not suitable to their needs. And in my mind, you've got 6 million unoccupied bedrooms in the UK. If we made better use of that, that's 20 years worth of housing supply right there. And so in my mind, reduce the transaction costs, encourage people to actively make the choice to move into somewhere that's suitable. And then to touch on your technology point, we're right in the early foothills of technology making a real difference. And I think the elderly have been left behind to date, and it's starting to catch up. Even if I think about little things like social media, I'm starting to be introduced to proprietary software helping storytelling, as an example, and how we do a later living version of storytelling and capturing that story and sharing experience. And I can see that's where Neil's comment I share is technology will be useful, and particularly useful if it leads towards people living a more thriving life and getting more out of life.
If I could just add one thing, my neighbour here is a kidney surgeon, by the way. She says the vast majority of, or like a large proportion of kidneys that she gets are from falls downstairs of working age adults. So we might all need to watch out on that one. But what I would say from a stamp duty perspective, I think it does help, but I think it's important to remember that that is effectively a demand side measure. And even if we give everyone a stamp duty reduction, there can be phenomenal demand. But if there's not the right commensurate supply, that means prices will rise. So we need to not just look at, how can we make it cheaper to buy into them, but we need to make it actually easier to build them in the first place. I think it's important to remember.
Lovely. And then one other comment, given that we've seen a lot of the housing stock movement in the last few months be people moving to larger accommodation, do you think that the sort of the case for downsizing or finding more suitable accommodation that's a little easier to manage has actually become slightly harder, because the benefits of having a garden these days is somewhat higher than it was? Mike, I can see you're shaking your head.
No, because I think, if you look at large scale surveys about what do people look for when they're moving to one of like a retirement community with care and support, bars, gyms and whatnot, the actual physical property is in the number of things that why people move is like number 7 or something like that. And don't get me wrong, you need to build them well, you need to build them spacious, outside space is important. But typically people who are, the average age of people moving to a retirement community is 79 years of age. They don't suddenly wake up in the house they lived in for 40 years and think, I'd really like a bigger house. That is not why they're going to come to Phil and buy one of his communities. They move there because they might be lonely, they might be planning for the future, they might have a bit of support needs, they might be able to not look after their house anymore. So I think the upsizing thing is a red herring.
Yep. Thank you very much. I think we're coming towards the last couple of minutes of our session, so I'd like to close by asking each of you to put forward your number one priority for this sector, as it were, and perhaps just a one-liner or comment as to why that's the case. So, Jeremy, perhaps if I could invite you to make the first of those comments.
Well, it's going to sound a very bureaucratic thing to say, but I do think we've got to have a proper long-term plan on this. The social care system has been going from hand to mouth now for a very long time, and we need to do some of the strategic thinking that all my colleagues on the panel have been talking about, and that is partly about the core funding. It's partly about creating incentives for people to save for their own healthcare. It's partly about the housing issues, the education issues that have been raised. But I just think that what we probably need to say is we're going to have a 10-year plan for the social care sector and make sure it covers off all of these different elements in a thoughtful way. And I think that this is really what the country is expecting of us now. People know how tough it's been this year, but it's certainly no tougher than it was in 1948 when we took the bold decision to set up the NHS. And I think this is a moment to rise to the challenge.
Super, thank you very much. And we're on our last minute, so Phil, do you want to make a comment there?
Again, great context of the start of the NHS. That puts things in perspective. Mine's more supply, more choice for customers. We need the bottleneck I'm experiencing is we've got long-term pension money ready to invest and solve public problems, and we can't because not enough local authorities are engaging with us and taking responsibility for housing, building the appropriate housing for their local aging population. So 20% of all new delivery be purpose-built retirement communities, please, Jeremy.
There we go. And Samir.
Yes, the NHS actually started about 1943, and the London Ring Road was designed in 1943 in the middle of the war. Jeremy, we're in the middle of a war at the moment with COVID, but that will pass. So I'd like to say, could you please start finding little bits of time in your excellent committee chairing? And I think we don't need a social care system, we need a system for living longer better that will involve Age UK, business, Sport England, local authorities, NHS. So Jeremy, if you give us that bit of leadership that you've given us in the past, then I think we can do something dramatic. But we probably need to start in January 2021.
Excellent. And a final comment from Michael.
I think the top of my wish list would be that, interestingly, we've been talking about health and social care, but actually most of the levers that I think would make this sector grow sit outside of DHSC. It's 10-year models and planning with MHCLG, regulation is with Bayliss. So what I'd say is I would lock Matt Hancock, Alok Sharma, and Robert Jenrick in a room until they basically have a plan, and then we would let them out. In the absence of that, I believe that would be the tort of unlawful imprisonment. In the absence of that, I think they need a task force to sit down and quickly see how can we expand the sector. And as a housing with care task force is certainly something we've been pushing for.
Thank you, Michael. On that note, that brings us to the end of our debate. Thank you very much to our panelists for a really good conversation. And to ARCO for being our partner for this event, and of course to our audience for the questions that you've been sending through as well. So if you'd like to know more about Bright Blue or become a member, do check out our website. We have a couple of events on net zero and destitution, two different things on Tuesday the 1st, so have a look at that online. Otherwise, thank you again for joining us and enjoy the rest of the day.